Hi everyone, and welcome to the third in the series of the LSN's Ask the Expert videos. I'm Anita Wallace, Chair of the Lymphedema Support Network, and I'm delighted today to introduce you to the LSN's nurse advisor, Denise Hardy, who runs a very busy practice in Kendal, and she's very, very experienced. So I'm delighted that she's agreed to come on with us, and we'll get going on the questions. The next question is, why do some people get a lot of pain with a lymphedema and others just feel like their limb is heavy? And if you do get pain, what are the best painkillers to take and the ones to avoid?
Yeah, everybody's so totally different, aren't they, when it comes to lymphedema. I'm never ceases to amaze me that someone can have a very, very mild swelling and yet that person thinks it's really uncomfortable, and I can get somebody who's got a massive swelling, who's had it for a long, long time, and that just doesn't seem to cause them a problem at all. So everybody is completely different in regard to pain and how their lymphedema affects them, whether that be physically or psychologically. But for me, if somebody does say that the lymphedema is painful, then I really have to go back to basics and assess it, because we do say lymphedema isn't painful, acutely painful. We do say that it can be heavy and uncomfortable, and there is all this range of sort of names that follow that. But any pain needs to be investigated, in my opinion. I'm not a doctor, and therefore, I will do my assessment. And if I think that pain is perhaps related to something else, then I will refer back to the referring GP or consultant. And that's really important, because acute pain does need to be addressed differently.
Yes.
But if it's due to their lymphedema, there are all sorts of reasons why it might be uncomfortable. One of them, of course, it might be that their swelling has been there a long time without any treatment, and therefore they've got a very large limb, for example, that's pulling on all supporting joints and muscles, and that can lead to all sorts of strain in those particular areas. So addressing the limb, taking control of the lymphedema and managing that and making it smaller, means that that pain, that stress on those supporting joints and muscles will be released. And immediately they'll start to get some relief from that. And it's the same with the limb feeling uncomfortable too. If it's stretched and taut and heavy, by reducing the pressure of that by our compression methods of whatever kind, that feeling will go. That feeling of it stretching and being taut over the tissues will be diminished. So sometimes just starting treatment is really helpful. Infection, of course, is another reason why somebody will get pain, and treating that appropriately with antibiotics and, of course, paracetamol regularly until that acute infection subsides is helpful. Others will get nerve pain. Sometimes the swelling is irritating the nerves, and again, by reducing the swelling, that symptom will subside. Okay. Or they might need some sort of medication to help with that. And again, that is where our GPs come in handy in saying, is there anything you can suggest that will help with that? And the other thing, of course, is that it might be due to something else. They might have another comorbidity that is causing the pain.
What does that mean, Denise, comorbidity?
So another condition that is contributing to it. So, for example, arthritis. So if they've got an arthritic hip, but they've also got lymphedema in that leg, it's hard to determine what's causing that pain.
Yes, I understand.
So it's teasing out, what actually is causing the pain, and that sometimes takes time. Sometimes we need to send our patients away for X-rays or whatever. So, you can't just come into clinic and think, we're going to solve it just like that. Sometimes it takes a little of time, but by working together, the patient and our therapists, we can usually come up with an answer. And yes, drugs may help. Our first line would be paracetamol if we know that it's safe for that patient to particularly have that. But I wouldn't be suggesting certain medications without again speaking to the GP, because I never know fully whether that patient is on a ream of other medications. They sometimes remember what they're taking and sometimes they don't. So I would always go back to the doctor, and for example, if I felt that a non-steroidal, something like naproxen might be of help, or whatever, ibuprofen, for example, and they're on warfarin, me suggesting that wouldn't be helpful to them.
No, quite.
I mean, me recommending something like a drug of that type is better done by talking to the GP first.
Yeah, it's not really appropriate for you to comment, is it? No.
Exactly. No. But equally, things like suggesting a TENS machine for nerve pain. A TENS machine, some people may know that as using it during pregnancy or during labour. It's electrostimulation, and sometimes things like that can be really helpful. We have low-level laser machines that can be helpful. We have other types of electronic equipment in our clinic that we use for pain relief, and all of that, you know, can just be as useful as taking a tablet.
Yes.
I think
sadly that sort of therapy is not available in every clinic, is it?
No, it's not.
That's trouble.
But again, if most of the therapists will know of those things and can direct them to where they might be able to loan them, for example.
Sure.
So, you know, just because you haven't got it doesn't mean to say you can't try it somehow. Where there's a will, there's a way, I think, usually. So it's just a matter of finding out and directing patients. But generally, I think if you can reduce the lymphedema, that will generally help a lot of the people.
Yes, yeah. Does exercise help with it at all? I don't mean intense exercise. I mean just, you know, sort of bending and stretching your arm or something like that, just to get it moving. Can that help?
A lot of time when people, before they're actually diagnosed with lymphedema, they tend to guard it, particularly, for example, if it's a breast cancer related lymphedema. They've got a very heavy arm, they'll just guard it, they won't move it, and then they get all stiff and uncomfortable.
Whereas
if you start to just gently get the joints moving, then the pain reduces quite nicely. So exercise can really help. And it's the same, isn't it? You know, if you've been in bed all night and you wake up and you're really stiff, as soon as you start moving.
Yeah, absolutely.
So, yeah, definitely exercise is a great help for many.
Lovely. Thank you very much, Denise. Thank you.